Safe handling of hazardous medicines at home, giving whole tablets or capsules. This video will show you how to give hazardous medicine tablets or capsules safely. Always follow these safe handling methods to provide the best protection for you and your family during your child's treatment. Sometimes people who care for patients must handle hazardous medicines. Hazardous medicines can treat a variety of medical conditions. For instance, chemotherapy treats cancer, and immunosuppressants prevent organ rejection after a transplant. Ask your healthcare provider if your child's medicine requires safe handling. Hazardous medicines can damage healthy cells, so they must be handled safely. The risk of harm from handling hazardous medicines is small, but it's still a good idea to avoid direct contact with them. This includes not tasting your child's medicine, and if possible, avoid contact with hazardous medicines if you are pregnant or breastfeeding. You will need to gather certain supplies and take careful steps when setting up your work area. Your child's healthcare provider will help you make a list of the supplies you will need. You can buy these materials at a grocery or drugstore. To handle your child's hazardous medicine at home, choose an uncluttered counter or table away from windows, fans, vents, areas where you prepare food, and where children and pets play. Depending on how you prepare your child's medicine, your supplies may include paper towels or a disposable absorbent plastic-backed mat to contain any spills, gloves to minimize direct contact with the medicine, a medicine cup to hold the tablets, tweezers to pick up the medicine, a suitable drink. Your child's healthcare provider will tell you which foods or liquids can be mixed with your child's medicine. And lastly, your child's medicine. Always prepare the medicine right before your child will take it. Before you begin, wash your hands with soap and water. Put on your gloves and place paper towels or a disposable absorbent plastic-backed mat over the counter surface. You are now ready to handle your child's medicine. If your child takes their medicine in a pill and they are able to swallow the pill whole, you do not need to do any other preparation. Open the medication bottle and, with or without tweezers, remove the required number of tablets and place them into the medicine cup. Put the lid back on the medicine bottle as soon as possible. Using the medicine cup and not their hands, have your child swallow each pill whole with an approved drink. Make sure your child washes their hands first, takes their dose as directed, and washes their hands afterwards. If your child cannot swallow tablets, please watch the video about preparing tablets as a liquid. Hazardous medicines should be handled safely. It's important to carefully handle the cleanup of the supplies and work area and to dispose of waste properly. All disposable items that have been in contact with the hazardous medicines, such as the used paper towels and gloves, must go into a designated plastic waste bag or container. Dispose of this plastic bag at a hazardous waste depot. You may wash and reuse some of your supplies, but take care not to rinse them in the kitchen sink over other dishes or utensils. If you are reusing an item, such as the medicine cup, rinse with warm soapy water and let it air dry. Clean the sink after washing your supplies. Always store hazardous medicines away from children and pets. If stored at room temperature, place them in a locked box away from moisture and direct sunlight and in a cool, dry place. If the medicine needs refrigeration, place it in a separate container at the back of the fridge. Return the medicine to the locked box or fridge after each use. Do not keep any medicine in your purse, knapsack, or diaper bag. Some of the medicine may be present in your child's vomit, urine, and stool. It is important to handle these safely as well. When changing your child's diaper, wear disposable gloves and place diapers in a separate sealed plastic bag before disposal. If your child is toilet trained, have your child close the lid and flush twice after using the toilet, and then have them wash their hands. If your child's clothing or sheets are soiled with vomit, urine, or stool, wash them separately from other laundry. If you can't wash them right away, place them in a sealed plastic bag and set them aside. Once you are all finished, wash your hands. Remember these key tips for safe handling of hazardous medicines at home. If possible, avoid contact with hazardous medicines if you are pregnant or breastfeeding. Wash your hands before and after handling hazardous medicines. Wear gloves when handling hazardous medicine tablets, capsules, or liquids. Properly clean, dispose, or store the equipment and hazardous medicine. For more information on these tips, speak to your healthcare provider.